Hey everyone, it's Dr. Mike here. Today we're diving into a crucial topic that could save your life or the life of someone you love. We're talking about those subtle changes in your body that can sometimes be easy to brush off, but shouldn't be ignored, especially as we get a little older. If you're between 55 and 70, you need to pay close attention to these 7 sudden changes in your body that you must not ignore. These changes might seem small at first, but they can be powerful warning signs of some serious health conditions. We're going to break down each one, talk about what to look out for, and most importantly, what you need to do if you experience them. All right, let's jump right into the first one, sudden weight loss. Now, we all know losing a few pounds can be a good thing, especially if we've been working hard at it, but I'm talking about dropping weight rapidly without even trying. If you suddenly find your clothes fitting looser or you're losing more than 5% of your body weight within 6 to 12 months without any major lifestyle changes, that's a big red flag. Why is this such a concern? Well, unexplained weight loss could be a sign of several serious health issues. One possibility is cancer. Certain types of cancer can cause your body to burn calories at a much faster rate than normal, leading to rapid weight loss. Another culprit could be hyperthyroidism, a condition where your thyroid gland produces too much thyroid hormone. This hormone is like your body's gas pedal, controlling your metabolism. When it's in overdrive, you burn energy too quickly, leading to weight loss. Now, I don't want to scare you, but it's crucial to take this seriously. If you're experiencing sudden, unexplained weight loss, don't just assume it's nothing. Schedule a visit with your doctor right away to get checked out. Early detection is key when it comes to these conditions. Let's move on to our next sign, sudden shortness of breath. We all get winded sometimes, especially after climbing a flight of stairs or chasing after the grandkids, but if you find yourself struggling to catch your breath after doing things that never used to bother you, that's a signal you can't afford to ignore. Sudden shortness of breath, also known as dyspnea, can be a warning sign of heart and lung problems. Think of it like this. Your heart and lungs work together to deliver oxygen throughout your body. If either of these systems isn't working properly, you're going to feel it in your breathing. One of the most concerning possibilities is heart disease. When your heart is weak or has narrowed arteries, it can't pump blood as efficiently. This can cause fluid to build up in your lungs, making it hard to breathe. Another possibility is a pulmonary embolism, which is a blood clot in the lungs. This is a serious condition that requires immediate medical attention. Of course, shortness of breath can also be caused by less serious things like allergies, a cold, or even anxiety. But if it comes on suddenly, is severe, or is accompanied by chest pain, dizziness, or a rapid heartbeat, call 911 immediately. Now let's talk about our third sign, sudden vision changes. Sudden vision changes can signal serious conditions like stroke, macular degeneration, or retinal detachment. Seek immediate medical attention if you experience any sudden vision changes. Moving on to our fourth sign, sudden confusion or memory loss. We all have those senior moments where we forget where we put our keys or can't remember someone's name. But sudden confusion or memory loss can be serious. It can indicate stroke, TIA, infection, medication side effects, or dementia. A stroke interrupts blood flow to the brain, damaging cells. This affects cognitive function, leading to confusion and memory issues. A TIA is a temporary blockage with similar symptoms. Symptoms resolve within 24 hours but signal stroke risk. Infections and medications can also cause confusion. Dementia develops gradually, but sudden changes can be early signs. Contact your doctor if you notice sudden changes. Early diagnosis and treatment can make a significant difference. Chapter 5. Chest pain. When your heart sends an SOS. Let's talk about a symptom that often sends a chill down our spines: sudden chest pain. This is one sign you never want to ignore, especially if you're over 55. While it can be caused by something as simple as heartburn or muscle strain, chest pain can also signal a life-threatening condition like a heart attack. Heart attacks occur when blood flow to a part of your heart is blocked, usually by a blood clot. This can damage or destroy heart muscle, and time is of the essence when it comes to treatment. The classic signs of a heart attack include crushing chest pain that feels like pressure or squeezing, pain that radiates down your left arm or up into your jaw, shortness of breath, sweating, nausea, and lightheadedness. However, not everyone experiences the same symptoms during a heart attack. Some people, especially women and older adults, may have atypical symptoms like back pain, indigestion, or just a general feeling of unease. If you experience any kind of chest pain, especially if it's severe, comes on suddenly, or lasts for more than a few minutes, call 911 immediately. Don't try to drive yourself to the hospital. Every minute counts when it comes to treating a heart attack. Chapter 6. Numbness and weakness. When your body loses its grip. Now let's discuss another alarming symptom: sudden numbness or weakness in the limbs. If you've ever experienced that pins and needles sensation after sitting on your foot for too long, you know what numbness feels like. But if you suddenly experience numbness, weakness or paralysis in your face, arm or leg, especially on one side of your body, it could be a sign of a stroke. As we've discussed, a stroke occurs when blood flow to a part of your brain is interrupted. This can damage brain cells that control movement and sensation, leading to sudden numbness or weakness. Other symptoms that can accompany stroke include sudden confusion, trouble speaking or understanding speech, sudden vision problems, sudden dizziness or loss of balance, and sudden severe headache. Remember the acronym FAST. Face drooping. Does one side of the face droop when the person smiles? Arm weakness. Is one arm weak or numb? Can the person raise both arms evenly? Speech difficulty. Is their speech slurred? Can they repeat a simple sentence? Time to call 911. If you observe any of these signs, even if they are fleeting, call 911 immediately. Time is brain when it comes to stroke. The sooner treatment is received, the better the chances of recovery. Chapter 7. Bowel and bladder changes. Silent signs you shouldn't ignore. Finally, let's talk about a topic that might feel a little uncomfortable, but it's crucial to address: sudden changes in bowel or bladder habits. Our digestive and urinary systems naturally change as we age, but any sudden or significant changes in your bowel or bladder habits could be a sign of a serious underlying condition. Sudden changes in bowel habits such as constipation, diarrhea, blood in the stool, or a change in stool color or consistency can be a sign of colon cancer, inflammatory bowel disease, or other digestive disorders. Sudden changes in bladder habits, such as increased frequency, urgency, pain or burning during urination, blood in the urine, or difficulty starting or stopping urination, can be a sign of a urinary tract infection, bladder cancer, prostate problems, or other urological conditions. While many of these changes can be caused by less serious conditions, it's essential to get checked out by your doctor to rule out anything serious. Early detection is key when it comes to many of these conditions. Outro: stay aware, stay healthy. Remember, your health is your wealth. If you or someone you know is experiencing any of these symptoms, don't wait. Consult a healthcare professional immediately. Early detection and treatment can make all the difference. I know it can be scary to think about these things, but knowledge is power. By being aware of these potential warning signs and taking action when necessary, you can take control of your health and live a longer, healthier life. Stay healthy, stay informed, and I'll see you in the next video.